This chapter will cover the introduction of anatomy and physiology. We'll look at some major terminologies and just an overview of what anatomy and physiology will cover. The main objectives of this chapter is to get you introduced to various subdisciplines of anatomy and physiology, just an overview of scientific experiments and how they collect data from experimentation. And then we look at some basic themes in anatomy and physiology, different structural organization of an organism. And the main takeaway from this chapter is for you to understand the interrelatedness of different uh, forms and functions of the structure. But as we go through the course, you will get a better sense of how everything in the body is interrelated and form defines function. And the last topic we will be covering in the video lecture is homeostasis. Now, if there's one thing you will always need to know in the healthcare field is the homeostatic mechanisms that you will need to focus on. Make sure you understand this really well, just so you get a better understanding of the physiology portion when you move to pathophysiology lectures or anatomy 2. And in the classroom, we look at different anatomical positions, basic directional terminologies that you will need to know, body cavities, and the general organs in each body cavities. So by the end of this chapter, you should be able to apply these terminologies to every chapter. And every time you're talking about the human body, you should practice applying these directional terms. First, let's talk about Andreas Vesalius. Andreas Vesalius was a young, about 25-year-old physician. He was born in Belgium. So up until the 16th century, everybody in Europe and around the world only had a very basic understanding of human and anatomy of humans and animals. Before Andreas Vesalius, Galen's legacy was considered the most important in the field of medicine. So Andreas Vesalius um, worked on comparative anatomy. So he looked at human corpses and he also compared it to other animals. And he's considered the father of anatomy because he is the one who was able to give a lot of accurate description of human anatomy. So a lot of his work is believed to have, set a ground for human anatomy, and that's why he's known as the father of human anatomy. And back in the day, in the 16th century, of course, studying human anatomy was not easy because a lot of times these scientists would have to work on stolen human bodies to study human anatomy. And obviously, it was a profession to steal bodies that were just buried. Of course, it was illegal, uh, but the fresher the bodies, the more money they got. So a lot of scientists like Andreas would work on bodies that have been exhumed after the burial because science was still a very new thing in the 16th century. Right? So Andreas Vesalius is considered the father of human anatomy. So what is anatomy actually? Anatomy is the study of structure. Now, anatomy is consistent. So ever since we have known the details about human anatomy, it's been fairly consistent. But the anatomy, if broken up, ana means up, tome means cutting. So anatomy means cutting up. And anatomy is the study of structure, different organs and different organ systems and tissues and cells in the body. If I talk all day about anatomy, you won't really get a clear understanding if you don't see it for yourself. So a lot of the first few weeks, we'll be studying different bones, bone markings, different muscles in the body, and slowly we'll move into the organ systems. So students in med school and physiotherapy actually perform dissection. Why? Because it is important to dissect and study the human body, and that's why the process is called dissection. Dissection means cutting apart and putting things together. Okay, so like I said, tome means to cut up. So tonsillectomy means cutting up the tonsils. Appendectomy means cutting up the appendix when somebody is diagnosed with appendicitis. And cadaver dissection and prosection are two different terms. Dissection is done by first removing the skin and subcutaneous tissue. So dissection is when you dissect an organism or a sample or a specimen or a human being yourself. Prosection is when a specimen is pre-dissected and you just observe it. Okay, so when it's already cut up for you to observe, you're looking at a prosected specimen. Not every time we need to dissect a body. Now we have a lot of non-invasive techniques, including imaging techniques like MRI and CT scan, PET scan, and sonography, which you're pretty familiar with, to observe a lot of internal organs. So sonography, of course, ultrasound is performed in pregnant women. You can also look at sonography if you're looking at things like the bladder, the kidney, you can perform a sonography. PET scan, if you've heard of anybody who has undergone a surgery for a cancerous tissue, they perform PET scan to observe whether the tissue has been completely, or the tumor has been completely removed. I'm sure you have heard of MRI and CT scan. MRI stands for magnetic resonance imaging, and CT scan actually stands for computerized tomography. The main difference between MRI and CT scan is that MRI uses magnetic resonance, meaning radio waves. Okay, so MRI uses radio waves and CT scans use X-rays. They're both relatively low risk, but depending on the diagnosis, the physician might decide whether you need an MRI imaging or a CT scan, right? So MRI is really good at observing hard tissue like joint, brain, wrist, ankle, breast, heart, blood vessels, etc. Whereas CT scan is most helpful for observing sometimes fractures, tumors, so soft tissue, internal bleeding, to monitor any cancerous tissue. So CT scan is a lot of times used for soft tissue in the body, and MRI is used for hard tissue in general, but depending on the condition, the physician can decide either way. Now this is an image from a software that is attached to your textbook. It is called Anatomy and Physiology Reveal, that comes with McGraw-Hill Connect. And you can see how we can actually virtually dissect a human being using that software, which is amazing. So here you can see first you remove the skin and the subcutaneous tissue. and you remove all the fatty tissue. And when you remove a lot of fatty tissue, you start observing the muscles underneath. So when you perform cutting up yourself, cutting up, not yourself, I mean, when you perform cutting up a specimen on your own, it is called dissection. But if it's already performed and you're just observing a dissected body, it is called prosection. Now, what is physiology? Physiology is a study of function and interrelatedness between different structures in the body. So when you put anatomy and physiology together, you get a better understanding of how structure is related to function. So keep this in the back of your mind. Structure defines function. Okay, structure defines function. Now, function cannot occur without structure, and the function of an organ or a tissue is always dictated by the shape of the organ or the type of tissue. So we need to have a basic knowledge of chemistry and cell biology for understanding the functionality of the structures. As much as some of you might hate chemistry and physics, everything is important. Okay, so think about it. Why is your heart not where your stomach is? And why is your stomach not where your heart is? Right? Because everything is in a specific place for a reason, right? Your heart is right under your rib cage because that is the most important, one of the most, everything is important, but that is one of the most important organs in your body, and the rib cage protects your body, right? So the heart is under the rib cage for a reason. The brain is protected by the skull for the reason, correct? So keep in mind, structure defines function. You will hear this a lot as we progress through the subject. So eventually we'll look at each organ and organ system individually, and towards the end, I'm hoping you understand how different systems are tied up together. So in the clinical setting, we use a lot of basic non-invasive techniques. The first one is just a visual inspection of the body. You look for any changes in color, you look for rashes, you look for whether the person has good blood circulation. Do they look too pale? Are they anemic? These are some visual inspections that you can perform. Like in jaundice, when you inspect a person, jaundice is a condition which makes a person look yellow, and even the eyes look yellow. So that's an example of visual inspection. And then palpation is to gently touch the body surfaces with the hand. Now, palpation is like gently touching the abdomen to check any pain in the abdominal region. Keep in mind, palpation is different from palpitation, so make sure you know the difference. Palpation is gently touching the body surfaces with the hand, okay? And osculation is the process of listening to body sounds, and this is done with a stethoscope. So you can listen to the oscillation of the lungs during breathing to check for any crackling sounds associated with fluid accumulation or any infection in the lungs. So you can compare the differences in breathing between a normal person and an abnormal person who, say, is infected with pneumonia or has pneumothorax or a collapsed lung. And then percussion is the tapping of the body surfaces with fingertips. Now, those of you that have worked in with an orthopedic doctor in their office, they perform percussion by tapping the body surfaces. When you check the knee deflex, right, you're performing a percussion. Or when a physician is observing the general health of a person, They can tap, say, the heart region or the lung, for example, and listen to the echoes of the body region to test for the presence of air. For example, in the intestines, of course, it's more hollow, right? So you're going to have a very resonant sound in the bowel, right? And the lungs on the as well, you know, a healthy lung is really resonates. So when you tap the lungs, you can hear a hollow noise. And when you tap a lung that is that contains some tissue or some mass in it, it sounds really dull. Like when you tap a book, it gives a dull noise. But when you tap an empty shell, it's going to be resonate, right? So those are two examples of percussions that I can think of right now. So these are some general non-invasive techniques that uh, a clinician performs to examine the human body. Anatomy can be divided into several different subdivisions that can be divided into two major subdivisions. The first major subdivision is gross anatomy, and the second subdivision is microscopic anatomy. And the third subdivision that we won't focus on very much, that is developmental anatomy. So gross anatomy, not because it looks gross, is because you study a large body structure that can be seen without the use of a microscope, and that's why we call it an overall or gross anatomy. So these include structures like brain, heart, kidney, lungs, skin. All of these you can look at with your eyes and you don't need a microscope. So this is called gross anatomy. So in gross anatomy, if you're studying a particular body region, you can call it regional anatomy, or if you're studying a for example, let me give you an example of regional anatomy. Like if you are looking at the arm, that includes the skin, muscle, bones, nerves, blood vessels on the arm in general. That is called regional anatomy. Then you have systemic anatomy, where you're studying the body system. For example, the heart and the cardiovascular system, right? So that's an example of systemic anatomy. And then the third branch of anatomy is called surface anatomy. Surface anatomy. As the term suggests, this is just an examination of internal structures overlying the skin surfaces. And it is used for things like to locate the correct blood vessels, used for phlebotomy. So when people are looking for the veins to inject an IV, they're trying to look for the surface anatomy of the veins. Now, the next branch of anatomy is microscopic anatomy. Microscopic anatomy is the study of small structures that require a microscope. So then, the definition is very simple. Microscopic anatomy requires microscope to be seen. And this involves first making really tiny slices using a microtome, so they can cut sections as thin as 100 nanometer after they have been stained and fixed to a glass slide. Now, in normal circumstances, tissues dry up when they are left out for too long and they lose the structural integrity. And that's why we need to use a fixing solution to make sure the structures, internal structures, don't shrink, and thereby it allows us to observe the structures when we look at the samples under the microscope. Okay, so there are several branches of microscopic anatomy. First one is cytology. Cytology is the study of body cells. Cyto means cell. Okay, so keep this in mind because we will come across this term cyto again later in the chapter. So cytology is the study of body cells. Okay, so histology, on the other hand, is the study of body tissues. So these are two different types of microscopic anatomies. Histology is the study of tissues. Different cells make up a tissue, right? Different cells of the same kind organized together to form a tissue. And study of tissues is called histology. And then the third branch we have is developmental anatomy. Developmental anatomy is the study of the changes in an embryo through the lifespan. Okay, so starting from conception all the way to death is called developmental anatomy. However, embryology is a specific field in developmental anatomy. Embryology focuses on the changes before birth specifically. Okay, so these are the three main branches of anatomy. Over here, you see exploratory surgery, which is an example of gross anatomy. So you're able to see different structures in here with the naked eye. And then gross anatomy of the kidney is just another example. And yeah, let me say this, exploratory surgery is something that you do when you don't know exactly where uh, something is in this body region. Just say you know there's a tumor around here. So if you don't know where exactly it is, because there's so many different layers, somebody would perform an exploratory surgery. This type of surgery is fairly common in veterinary surgeries. Okay, not so much in humans. Sometimes it's needed, but very common in uh, surgeries for animals. And then over here, you have medical imaging that you're looking at. This is the femur, so that's the thigh. And over here, you see cytology. Cytology is an example of microscopic anatomy. So you study the cell. That's why it's called cytology. So physiology also has several branches, but we're not going to delve too deep into different branches of physiology. So some examples of physiology classification are respiratory physiology, which focuses on the functions of the respiratory system. Cardiovascular physiology focuses on the cardiovascular system, and so on. Like neurophysiology would focus on the nervous system. Renal physiology would focus on the kidneys and urine production and all of those. So we won't go too deep into physiology branches, but just keep in mind physiology is everything to do with functions of the body, which focuses on the molecular and cellular level.